Hi guys, my name is Trey Wisdom, a nurse practitioner student at Auburn University Graduate School of Nursing. And I'm here to talk to you guys today about a wildly interesting topic, tendinitis. So tendinitis is an inflammatory condition characterized by pain at the tendinous insertions into the bone. Now, tendinitis can occur in multiple areas of the body. The most common areas include the rotator cuff of the shoulder, insertion of the wrist extensors, i.e. lateral epicondylitis, tennis elbow, and flexors, patellar and popliteal tendons, the Achilles tendon of the heel, and the insertion of the posterior tibial tendon as well. A lot of new research is suggesting that tendinitis can also be referred to as tendinopathy, and it's kind of a broader term because not all tendinitis results in inflammation of the tendons. Patients with tendinopathy display tendons that are thicker but with a reduced load capacity. So for these tendons that have tendinitis or tendinopathy, they can't take on the load that a normal healthy tendon can. Basically, all that means is the overuse of these tendons causes this tendinitis and tendinopathy and results in haphazardly put together tendons, which makes sense. If your tendons aren't put together like they're supposed to and they're put together haphazardly, they're not going to be able to take on the load that a normal healthy tendon is going to be able to take on. Some risk factors for this disorder include overuse. So mainly sports players, tennis players, golf players, any kind of activity that's going to cause you to overuse your tendon is going to put you at risk for tendinitis. And some clinical manifestations include obviously some swelling, pain at the site. You're going to notice increased pain when you try to use these tendons. Like for instance, when you swing a tennis racket, when you swing a golf club, you're going to notice this increased pain and because of the overuse of these tendons that are haphazardly put together. So you may be asking, well, how do I know if I have tendinitis? What will my doctor do to try to diagnose it? A lot of times they'll do x-rays. Sometimes they'll do MRI scanning just to make sure there's nothing more than the inflammatory process that's going on. So that's what you'll kind of expect when you go and see the doctor. And a lot of times they'll tell you that the best way to treat tendinitis is going to be to stay at home, rest, ice, and over-the-counter anti-inflammatories such as ibuprofen.
Hey Billy, watch this. I'm like Captain Gilmore. Ow! Biscuits and gravy. My shoulder's killing me. Whew. Whew. Yeah, sure is swollen. It's almost like my tendons is thicker and bigger. Whew. You reckon I got the tendinitis?